Good evening. Namaste. This is Dr. Aparna. I am your emotional healing synergist. I am an Ayurvedic psychotherapist, a passionate infopreneur, medical writer, and a budding YouTuber. In my pursuit to address, promote, and propagate Ayurveda and psychotherapy globally, I come up with discussions every week on LinkedIn and YouTube. So, previously in two of my sessions, I had talked through autism. So, what is autism? What are the signs and symptoms of autism? What is the incidence of autism? Risk factors, types of autism. And today, we are going to discuss the management aspect. So, how do we assess autism? How is the assessment of autism done, and what are the major goals of therapy, and what is the parents role, because parents role is absolutely, you know quintessential. What parents can do to their child, no one else can do in this planet. So their role is very much important. And then we shall discuss about the different therapies involved in autism, which are tailored to the respective child's respective needs. So uh, you know uh, l- without wasting time, let's get started. So here, I have already explained what is autism. Please, what is autism, types of autism, everything in the last two sessions. So please refer to those sessions before you watch this one. So just for the recap, see, autism or autism spectrum disorder is a neurodevelopmental condition. So what happens is that affects social interaction, communication, behavior, and sensory processing in the child. So this disorder is autism is characterized by a wide range of strengths and challenges. That is why it is called spectrum. So it's because it manifests differently and in different child. So we had also discussed that what are the parameters that indicate that the child has autism. That means social challenges, that means difficulty with social interactions, limited interest in or understanding of social cues, communication differences, delayed or atypical language development. This may include repetitive language, limited speech, difficulties in understanding and using verbal and non-verbal communication. And we had discussed about some hand flapping, the repetitive behaviors and interests. So engaging these children engage in repetitive movements like hand flapping, rocking, or rolling, and rotating, so lining up things, objects in a specific way, all of these repetitive behaviors. There are some sensory, there may be some sensory sensitivities to light, sound, textures, or smell, etc. They may have a rigid routine. That means the child prefers for same routines. So they do not accept a disruption to their routines, and it is difficult for them adapting to unexpected changes. And their environmental is usually scheduled. So, and unusual play patterns, that they don't pretend play, and engaging in play that may appear repetitive or scripted. And difficulty, challenges in understanding and responding to the emotions and perspective of others. All this we had discussed in the previous sessions. So here, one thing is, before going to the therapy aspect, See, why, what are the major goals of therapy? What can we expect? What can the parents and the child expect when they are going for therapy in autism? So, to maximize the child's ability to function independently, this is the first thing, with minimum assistance, or going on with no assistance. That means to maximize the child's ability to function. Next, whatever is affected, like communication and language skills, social skills, play skills, self care skills, all these are learnt. And see, autism spectrum disorder treatment goal includes maximizing a child's ability to function independently and enhancing their developing and learning. That is, to improve their learning and development. That means to improve core deficits, whatever in the social communication and social interactions, and minimize the impact of their restricted behaviors. So, with a goal to help children to develop greater functional skills and independence. So, this is the goal. We want to make the child more independent, and to communicate, improve the social communication, social interaction, and eventually that the child can go to the normal school and lead a possibly normal life. So, and the next question is, the first thing here is, one is hope and second is acceptance. Parents here sometimes are not willing to accept that their child is suffering from, the child has autism. So here I will give some of the, how to assess, like how is autism assessed in toddlers, because it involves a comprehensive evaluation process. There is a process. So, what it does is, we observe and we gather information about the child's behavior, communication, social interactions, and development. Everything. The child's behavior, communication, social interactions, and development. So, what we do is, first is developmental history. So, what is done is basically interviews with parents or caregivers to gather information about child's developmental milestones. So most of the times the developmental milestones are affected, then behaviors and any other concerns. What happens is, this provides a foundation for understanding the child's developmental trajectory, whatever the developmental trajectory of the child is, and red flags that may, warrant further assessment, that may need further assessment. Next, what we do is observation and interaction. So, we train professionals observe the child in various settings to to assess how they interact, how they play, how they communicate, how they respond to different stimuli. What happens is, for example, a child's response to a peer's attempt to engage in a play. Suppose a child, there are two children here. One child is, we are predicting autism here. So we will see, for example, that child's response to another child's attempt to engage in a play, is it engaging? Can this What happens is, this will provide insights into social interactions. So the next assessment is on communication skills. So assessment, what we assess here is expressive language. What How is the speech, and how is the other forms of communication? Receptive language, understanding or spoken, and visual information. And how can it the child is, reacting to the non-verbal communication? Is it responding to the is the child responding to the non-verbal cues and communication? So, an assessment, for example, an assessment may involve observing if the child uses gestures, makes eye contact. Is the child using the gestures? The main thing we discussed in the previous session as well, that here the child cannot make eye contact while speaking. So, and we check for attempts to communicate. If they want something, if the child wants something, if for example if the child is hungry, is it able to communicate the need to the parents and the caregiver? That also we assess. All these we assess in the communication skills and social interaction aspect. So here it is, evaluation is done on the basis of how the child engages with others, including parents, friends, teachers, professionals, etc. How does it engage? Because these children sometimes want to be always isolated. So for example, joint attention, where a child shares focus on an object or activity with other person. How is the interaction with the other child or other person? This is an important social skill which needs to be assessed. Next is behavioral assessment, the most important thing. So there are some standardized tools, that means diagnostic observation schedule. They are called ADOS. So they involve specific activities and behaviors, that we check for specific activities and behaviors for autism. That means what happens is, these what assessments we do help us in systematically observing and recording behaviors that are characteristic, that are characteristic to autism. They're of autism. That means if we know the level of the child's behavior, we can make a plan for treatment. What happens is, let's consider that the child is 7 years of age, and he is behaving, and his mental development and growth is of a 2 or 3-year old. So we need to actually go into their behaviors, their interactions and everything, to assess that the therapy plan. Because we cannot treat a 7-year or 8-year old like a 2-year or 3-year old. So we have to bridge that gap and bring the balance. And we can't overwhelm the child at once, that he is now behaving, if he is acting as a 2 or 3-year old, we cannot overwhelm him to act as a 8-year old, because there is no there is a lack in the neurodevelopment. So we have to get a balance between both. Next is sensory sensitivities and repetitive behaviors. That means we assess how the child responds to sensory input, and whether they engage in repetitive behaviors or routine, like hand flapping. When they get excited, they start repeating some words. There is a concept called echolalia. That means a child, when you say something, you say the child to give the pen to you. If you say give the pen, the child will repeat the same. That means instead of giving you the pen, the child is repeating the same. So we assess all those repetitive behaviors and their routines. So as I said, that children with autism do not like a disruption in their schedules. So what happens is, we look for their schedules. So, an assessment might involve observing if the child is sensitive to certain textures, sound, or lights. All this will be assessed. Next is cognitive and motor skills. So, evaluating the child's intellectual functioning. As I said, is the child's intellectual functioning the age appropriate or not? That means the same example I gave. A 7 or 8-year child's intellectual ability, for example, is of a 3-year, 2-year, or 3-year old. Then we assess this in the cognitive and motor skills. to understand their overall development level, how what is the rate of the development. So what happens, this provides information about the child's cognitive abilities and any areas where they may need additional support. Next is adaptive functioning. So, assessing the child's ability to perform daily activities. That means how much assistance or help the child requires in daily activities. So, a 7 year or 8 year old child is almost, majorly independent. It can, so how far it is like, and tasks necessary for independent living such as self care, communication, problem solving, all these assessment is done. And this may involve observing how the child manages self care tasks like dressing or feeding. Is the child able to take bath by itself, dressing, can the child feed itself, you know can the child do homework on itself, etc. And medical and next is medical and genetic evaluation. So we conduct a thorough medical evaluation to rule out any other medical condition or genetic syndromes. This is differential diagnosis associated with autism like behaviors. So whether it is autism or not, to rule out. So identifying any co-occurring medical conditions is important for providing holistic care. So next is parent or caregiver input. That means gathering perspectives and observations from parents or caregivers. This is the most important thing regarding the child's behavior, because how much the extent of information parents can give, nobody can give about their children. So, we gather perspectives and observation from the parents or caregivers regarding the child's behavior in different settings and contexts. So, what happens is this helps us in understanding the child's behavior beyond the assessment sessions and in their natural development. So, this assessments need some time. Maybe it may include a psychotherapist, psychologist, speech therapist, occupational therapists, pediatricians. Sometimes it may include multiple people as well. So, the key here is early diagnosis and intervention are crucial for providing effective support for children with autism. That means if you bring the child within 2 to 3 years of age, that as early as the therapy is started in the child, it gets better. That the chances of the child becoming normal and leading a possibly normal life, the chances get higher. So next, after assessment, so next comes, what is the role of the parent here and or caregiver. How, because one is, what, as I said, what parents can do to their children, the difference they can bring to their life, nobody else can do, because they are constantly with the children. So supporting and engaging, see, one thing is here, autistic children need special care. They need constant engagement and consistent support. So this may be at times challenging for parents as well, because it is not very easy to constantly, because you parents also will have all the other works to do in between that. Giving time and a constantly engaging children is a key here. So supporting and engaging with autistic children, it also requires a multifaceted approach, because child has unique needs. So what is it is, first, education and awareness. That means parents, one is accepting. Accepting autism is really important when it comes to um, Children, parents are at times unwilling to accept that their child has autism. The second is understanding autism. See, educating parents need to educate and know about autism. So, how does it happen? How does it manifest in children? What happens is this knowledge will, guide the approach to support. Next is, you parents need to ensure that their child has access to an inclusive education environment that accommodates their learning style and provides necessary supports. Here, in the beginning, they have to create an environment for a child for to encourage their and support their learning and their specific needs. The next thing is effective communication here. That means be aware of your child communication preferences, to know, to be aware of the child's communication preferences, using verbal language, and sometimes you need to use sign language, picture exchange system, all these things. Sometimes you using visual supports like visual placards, visual schedules, books, the books having images and pictures, visual aids, and all these things, you should be prepared of. Next is emotional regulation. That means these children are emotionally also more needy. That means you have to create a calm and predictable environment at home where your child feels secure. You're not going to overwhelm the child, and also you are going to support the child in the right way, and that can regulate the emotions in the child. So teaching coping strategies, that means helping your child learn and practice coping strategies and managing emotions. For everything, in initially it is difficult because you have to give constant attention, constant engagement and consistent support. So you also, parents also need to be emotionally really strong for this. If they have to you know to make the autism very manageable, and so that the child leads a very normal life. Next is sensory support. Understanding your child's sensory sensitivities, whether they seek or avoid certain sensory experiences, adjusting the environment accordingly, etc. So providing sensory friendly items like fidgeted toys, noise cancelling headphones, and sensory swings. So accordingly, this is not, this, once you get in touch with the therapist, with the respective therapist, you will come to know that what all kind of sensory support is required. See, therapy session, you come to the session sometimes, till an hour or two or three, there is a session. After that, the child goes home. There, the parents and the caregivers only have to give, be constantly engaged, that in fun activities, and the child must not be emotionally deprived as well, and it should not be depressed and overwhelmed with the tasks. So it should be friendly. That means you don't go into the exactly teaching mode. You just be friends with them. You just pretend as if you are learning, and you are they are also learning with you, they are playing with you, they are equal partners with you. You involve them in such way. Next is the social skills development. That means structured social opportunities, creating opportunities for your child to interact with peers, like interact with the other children, creating an environment, where they interact with other children in a structured and supportive setting, like such as play dates or social skills group or joining some group. So all these things. Next, encourage special interests. That means you have to support passions. I have already discussed that autistic children have some special interests in some of the topics or subjects. They are numerically, logically, and numerically very good. They may very be good at musically or artistically, they may good. So recognizing and encouraging your child's special interests, these can be a source of comfort and motivation both for them, and can also be used as a tool for learning. That means it can be accompanied. Suppose if the child likes to play a piano, he is interested in music, so we can do that. If he does 1 hour of the study, or he does the 1 hour of sensory activities, then he is allowed to a piano. That motivates, that comforts and motivates the child. This is for example. And it, eventually it becomes a, it turns into a good habit and development. And incorporate, also incorporate interest into other learnings off from this. So find ways to incorporate their special interests into educational activities, as I said, which can enhance engagement and motivation. Then promoting, making them independent. Eventually a parent's goal is to make the child independent. That means set realistic expectations, gradually encourage age appropriate independence in daily tasks such as self care, meal preparation, organization. Involve them, they have to be one with the environment. That is the thing. One thing is, there are two types of learning in every children. One is active learning and second is the passive learning. See, active learning is that learning that we consciously feed to our children, like we make them understand. For example, the story books, the teaching of the numbers, the teaching of things. This is active learning where we have to put a conscious effort. But unfortunately, the active learning in children, in any child, is only 10%. All of us learn 90% passively. That means nobody has to teach us anything. See, if there are languages are home spoken languages, and we speak some dialects at home, we need not teach every word. If you start speaking in front of the child itself learns. That is called passive learning. And an environment, that is 90% in children. The active learning is only 10%. So you have to create an environment, parents have to create an environment wherein the child learns everything passively. So then, providing clear instructions, offer structured guidance and break tasks into manageable steps. As I said, you cannot overwhelm the child at once. Whatever the bridging of gap, etc., is there, it has to be done in a gradual progression. So everything cannot be done at once, because it will have a negative impact instead of a positive impact. Next is advocate for your child. Be an advocate for your child. That means collaborate with professionals. Work closely with teachers, therapists, and other professionals to ensure that your child's needs are met and their progress is monitored. So, all those things. And next is providing emotional support. See, nurturing emotional well being is essential for the overall development and happiness of the child. See, parents and caregivers, should offer comfort, validation, and reassurance. That means, and they also help their child navigate emotions and teach appropriate ways to express feelings. So, advancing independence and life skills, the main aim, as I said, is encouraging independence and teaching practical life skills, doing them independently. This is what, eventually the self care, the hygiene, the basic household chores, their homework, everything. We need our children to do them independently. So stay informed about the condition and seeking support. See, being proactive in seeking information and support is very much crucial for parents and caregivers. That means, you can attend workshops or support groups and seek out professional advice whenever needed, and network with other parents, having, where their child has autism. All this will, give insights, and you can share experiences, learn new things. And last but not the least is self care for parents as well. So that means you have to connect with other parents of autistic children for advice, empathy, shared experiences, who are already taking therapies and whose children are getting better. Consider joining support groups or online communities. And you have to also take, breaks, prioritize self care. You have to also recharge and maintain a healthy lifestyle. So if you are healthy, you can take care of your, child better. This enables you to better support your child. So one thing is, every autistic child is unique. So it is, important to observe, listen, and adapt your support strategies based on your child's needs and preferences. So the main thing is, you have to have patience, empathy, and unconditional love. Only those only can, help your child get out of, autism in the long run. So let's discuss majorly what are we, what can parents expect when they take therapy in autism. One is improving social skills. So enhancing the therapy, the therapy which is given enhances the ability to initiate and maintain social interactions, share attention, and understand social cues. Next is enhancing communication. So, developing effective communication skills, which may include verbal language, non-verbal communication, and alternative communication methods like sign language. You know, and reduce challenging behaviors, whatever the challenging behaviors are, addressing those behaviors, that may be disruptive, harmful, and impede the individual's ability to learn and engage in daily activities. For example, if a child is hungry, instead of saying I am hungry, if the child starts crying and shouting loudly, then you have to change that behavior. So addressing that behavior to, change it to the child telling you, letting you know that the child is hungry or the child needs something. So this is, reducing challenging behaviors. There are n number of challenging behaviors, that you need to address or reduce. And the main thing is, as we said, increase independence. So fostering self skills for self care, daily living activities, decision making to promote greater independence. Next, promote play and leisure skills. So this also is you learn while you, this is the goal of therapy. So encouraging appropriate play behaviors, imaginative play, and the ability to engage in activities. So improving academic skills. So the goal is also that when they are, when the child, if the child needs special schools, after a period of time, after after the therapy, it to make high chances that a child can go to a normal school. That means facilitating learning in various academic areas depending on the individual's age and developmental level. So enhance emotional regulation, teaching strategies. What is done in therapy is they teach here teaching strategies to recognize, express, and cope with emotions in a healthy and constructive manner, and addressing sensory sensitivities. So, developing strategies to manage sensory input and sensitivities to different stimuli. So, we will see what are the sensory sensitivities in when we once we continue through the therapy. And foster functional life skills. So functional life skills are targeting skills relevant to daily life, such as personal hygiene, meal preparation, and the household tasks. As they get older, they have to learn, skills that are that are very relevant to daily life, and facilitate generalization and maintenance. Ensuring this is also important, because ensuring that the learned skills and behaviors are applied in various settings and continued over a period of time. This takes time. Autism treatment takes time, and sometimes this could be a lifetime, but this takes time. And there are several types of therapies used for autistic children. So we will just know in brief what are the therapies. In the coming sessions, we will know each of the therapies, that how what is the goal, what is the how does it help, what are the techniques, everything we'll know. The first thing here is applied behavioral analysis, ABA. What does this applied behavioral analysis does is, this is a therapy. So ABA improves socially significant behaviors by systematically applying behavior principles, by applying the behavior principles, you know to improve the socially significant behaviors. That means teaching a child with autism to communicate using picture cards, gestures, or speech, and reinforcing positive communication attempts. Like teaching a child to communicate with picture cards, gestures, speech, and reinforcing positive communication attempts, by applying the systematically behavioral principles, by systematically applying behavioral principles. So we will discuss ABA, because ABA is the most effective treatment. We'll discuss it in detail, full detail in the next session. But here in this session, just know that ABA is a therapy for autism. The second is speech, and these therapies are tailored. It is not that one size fits all. Each child's requirements are different. Each child's challenges are different. It may be different to the different age groups as well. So in children, where there is a speech and language delay, there is speech we use speech and language therapy. So this therapy, what it does is, it focuses on improving communication skills, including speech, language comprehension, and social communication. So for example, working with the child on articulation exercises, that means to improve clarity. If there is less clarity in the speech, improving the speech clarity, teaching them how to initiate and maintain a conversation. This is all about speech and language. So next is the occupational therapy, OT. So, what this occupational therapy aims is to develop and improve fine and gross motor skills. See, motor skills, sensory skills, if the gait, for the hand movements, for the gait, etc. All of these to improve fine and gross motor skills, sensory processing, and activities for daily living. So, how helping a child develop fine motor skills through activities like cutting with scissors, teaching them cutting with scissors, and addressing sensory sensitivities. If the child is sensitive to light and sound, addressing those with desensitization techniques. So the next is, after the occupational therapy, the next is sensory integration therapy. It is not that every child requires every type of therapy, and some children may require multiple therapies. Both are there. So sensory integration therapy is, this therapy helps individual process sensory information more effectively and adaptively. So engaging a child in activities that expose them to different textures, like fur, maybe fur dolls, maybe hard textured ones, and exposing them to different textures, different sounds, how the animal sounds, how a cat sounds, how a buffalo sounds, how a horse sounds, how an elephant sounds, or how different vehicles sound, how a train does, etc., and movements, introducing them to textures, sounds, movements, gradually helping them to tolerate sensory inputs. So, this method is called sensory integration therapy. The next method is called social skills training. So, the social skills training, this focuses on enhancing social interaction, that is, understanding of social cues and building meaningful relationships. That means role playing scenarios to practice greetings. Hi, hello, saying hi, hello, good morning, good evening, sharing or taking turns. Once you speak, once you let the child speak, then you speak, once you let them speak. Interaction, or you do it between one child and another child, and providing feedback on appropriate social behaviors. If the social behavior is right, you reward the child as well. You give them the feedback and reward the child as well, because it motivates the child to repeat that behavior again. If you feel the greeting is very good, or the child has interacted good, in a good way, so you reward the child with with its, with the child's favorite thing, or a favorite food, like that. What happens is, next time the child remembers that, this motivates the child, and to repeat the social behaviors. So the next thing is cognitive behavioral therapy, CBT. So, CBT helps individuals recognize and modify thought patterns and behaviors. This is for, adults. This is cognitive behavioral therapy in autism is used very less. This is in bigger children, or in adults or teenagers. This is not usually done in toddlers. So teaching a teenager with autism to identify and challenge anxious thoughts in social situations, and providing coping strategies. As I said, this is for teenagers and adults with autism. So to it is to make them identify and challenge anxious thoughts in a social situation, and providing coping strategies to them. The next thing what is done is floor time. So this floor time method, what is it is, this approach emphasizes emotional and relational development, aiming to build strong foundational capacities for communication and interaction. So what it does is engaging with the child on their level. Floor time is, you sit on the floor and engaging with the child on their level. Suppose it is a 2 or 3 year old, you also pretend as if you are 2 or 3 year old, and engaging in their level, following their lead, and using play to promote engagement and emotional connection. You are engaging promoting the play as well. And you are building an emotional connection as well with the child to respond, for it to respond, for them to respond. So, teach, TEACCH, is treatment and education of autistic and communication related, handicapped children. This is a method. So, what is it? Is teach focuses on creating structured environments and visual supports to help individuals with, ASD, autism spectrum disorder, for their daily activities. This teach method is also used majorly, it is used for severe cases of autism, like providing a visual schedule to help the child to understand the sequence of tasks in their daily routine. You are giving a visual timetable or a visual display for them to understand their daily routine. You wake up, you brush your teeth, you take bath, you do your chores, all these things, this cycle. So, one point to remember is individual therapy goals should be tailored to the specific needs and strengths of each child, because each child's needs and challenges are different. So, sometimes what happens is a multi-model approach is required. Sometimes you need ABA therapy with speech therapy or occupational therapy. Likewise, you will need two or more therapies for a child. Multi-model approach, we call that as multi-model approach. Combining different therapies is often the most effective in addressing the diverse range of challenges in individuals with autism. So this is in brief of what all is done as in autism, and the assessment, how is the autism assessed, and major goals of therapy, what is the patient, parents role. So we've learned we have known about the parents role, and next is, in the next session, I'm going to discuss about what is ABA therapy in detail, because it is a evidence based, most effective therapy. We are going to discuss entirely about it. So, thanks for staying tuned. And if you have any queries, or if you want me to address any topic, so let me know in the comment section, and let me also know in and share your thoughts, what you felt of the of the session, and what are your takeaways. So thank you and namaste for today.